Hi students, it's Dr. Elizabeth Paul, and I'm really excited to introduce you to a guest we have today. I'm sure you're going to love meeting him. His name is Ollie Morton, and he's visiting for a couple of days, and he's from New Zealand. So I thought I would take an opportunity to interview him, learn a little bit more about the healthcare system in New Zealand, which we really haven't studied. So this should be really exciting. So Ollie, tell us a little bit about why you're here in America.
Well, I came across from New Zealand to study at the University of North Carolina, Chapel Hill. And I got a scholarship called the Robertson, where it's sort of focused on leadership. And so they're helping me develop my leadership skills while here in the United States.
Great.
And I've been very lucky to come down and spend a couple of days in Florida.
Great, great. And what year are you at UNC?
So I'm a freshman at UNC, and I am studying biomedical engineering, and I'm planning to minor in sustainable engineering over at Duke. And so I'm very fascinated with the intersection between medicine and device design. I'm not sure I want to become a doctor, but I really love the engineering side of things.
Awesome. And then tell me a little bit about your family.
Yeah, so both my parents are physicians. My dad is an emergency physician, and my mom works as a general practitioner. And my mum is from Australia, my dad is from New Zealand, but we've grown up in New Zealand, and so my dad has worked in the public sector at a public hospital, and my mum has worked as a general practitioner, and she's now a locum, so she's self-employed, and she's employed by different general practices around my local town.
Oh, interesting. And you said they at one point worked for Médecins Sans Frontières? Doctors Without Borders?
Oh, yeah. So my parents, they worked in Bhutan for at least a few months. I can't quite remember. I was quite young at the time. Worked in Bhutan, and so that was my first experience sort of living outside of New Zealand. And my dad worked to improve the primary healthcare system and working to bring the quality of that emergency care up in their capital.
Wow, how exciting.
Very exciting.
And you said that there are some folks from Bhutan living in your, tell us a little about where you live in New Zealand.
Yeah, so New Zealand is split up into two different islands. There's a North Island and a South Island, and my family and I, we live, or at least I used to live, in the top of the South Island. And that's a place called Nelson, and Nelson is one of the registered safe havens for refugees from Bhutan and Nepal. And so that means that throughout the last at least 10 years, my family and I have been very involved in that community, and it's meant that I've gone around to Bhutanese households, enjoyed meals with them, and in fact, some of the people that my family met in Bhutan have subsequently left Bhutan as refugees and come to New Zealand and been placed into Nelson, where we've reconnected at least 10 years later, which is really phenomenal.
Wow, that is so cool.
It really is, yeah.
Oh my gosh, that is really neat. So can you tell us a little bit about the healthcare system in your country?
Yeah, so the healthcare system is primarily funded by the government.
Like a universal healthcare?
That's right. So it's a universal healthcare system. And that means that on the day-to-day, if I had to go into the hospital, that is primarily covered. There are going to be some things where, like, if I have to get crutches or some other items on discharge, I might be charged for that. But generally, taxes that my parents pay and that I paid when I worked, that's what covers visits to the hospital. Now, there are some what would be considered private, where you can have surgeries that you can have, like quicker wait times, and sort of those like opt-in surgeries that aren't like life-threatening. You can use a private hospital where you pay for those services, but generally most people will go to public hospitals, sometimes have longer wait times, but your taxes cover that. There are some things that aren't covered by taxes. I know that includes adult dental care. And that's where I believe, I think about 1/3 of New Zealanders use private insurance, although I can't quite remember the number.
For their dental health?
I think, so it's things like dental health, and if you opt into going to a private hospital or getting those elective surgeries.
Okay. How expensive is, like, if you're going to go into the private hospital? is it substantially more expensive? Like, what type of person could actually access a private hospital?
So I'll use an example. We have something called ACC in New Zealand, which is a insurance provider. It's a like non-accusatory way of providing health insurance for accidents. And so typically when I've experienced, or like my mum, for example, has gone to a private hospital, but ACC has covered that. And so I'm not quite sure of the out-of-pocket cost, but it's definitely going to be significantly more expensive than going to a public hospital. I know that in terms of co-pays for visiting like a general practitioner, those can be from like $20 to $50. I don't believe the government set like an upper bound on that, but generally it's within those like couple of tens of dollars to a couple of hundreds of dollars for those kind of things. Dental care is probably in a few $100s. But thinking about the currency as well, New Zealand dollars, one New Zealand dollar is maybe 0.6 of a US dollar, so there's also an exchange rate there.
Okay. What about eye care? Is eye care covered under the public system?
So, to the best of my knowledge, I'll use myself as an example. So I've got optic nerve hypoplasia, which is a condition where the size of my optic nerve is reduced, and it means that I'm significantly vision impaired. Now, I've been registered with the government as a disabled person, and so that means that the government provides financial support, and that comes from taxes, from general taxation. And I believe that has covered surgery, such as I had muscle corrective surgery in my eye, and that type of thing where you're going to a public hospital. In terms of prescription glasses, those are going to be in the hundreds of dollars. And I don't believe that's covered. That's like a personal choice.
Okay.
Yep.
So you could buy some type of insurance program on the private side to support.
I believe you could.
Perhaps. Yeah.
Yeah, I think so.
Okay. Interesting. Can you tell us anything about the pharmaceutical program? Is it large? Do you know? And if you're not sure, that's okay too.
I'm going to be honest. My experience with that is not as much. Although I do understand that the government has put in sort of caps on how much can be charged for like prescriptions and that type of thing. Although my experience with that is quite limited.
Mm-hmm. So, and it's called, I guess, central purchasing via Pharmac, which I guess is
I think it's quite famous.
Yes. Yeah.
Internationally.
Yeah.
Although, again, I hadn't heard of it until I had a wee read about it before we did this interview. So I'm not sure how widespread it is in New Zealand. Although I think if you ask my parents, that would be a very widespread concept.
Yeah. And I guess it's very strictly controlled with fewer drugs at lower prices.
I think that's the goal, generally.
Okay, interesting. And comparing it was interesting, I looked at comparing New Zealand with the UK, with Canada, and the US, and compared those four types of healthcare systems. And I guess New Zealand is somewhat similar to, more similar to the UK. Mm-hmm. And but its outcomes are significantly better than the US. You put in significantly less money and your outcomes are significantly higher.
When thinking about, in terms of GDP, the New Zealand government spends about 9 to 11% of annual GDP on healthcare. And so New Zealand's GDP is only about $250 billion. And so for how many billions that they're putting in, really it's a good result. Mm-hmm. It's an effective result, and I think it's something that when I think about being a New Zealander, talking to Americans especially, I'm very proud that our country has sort of achieved that level of support for citizens and also residents. Long-term residents are also covered under our universal healthcare program.
Okay. And one thing we should have shared was the population of New Zealand.
Yeah, so New Zealand is only about just over 5 million people, 5.3 million. And I'm studying in North Carolina, and when I think about that, North Carolina's got about 11 million, so it's really half the population of one state in the US. So it's a tiny speck of dust compared to you guys. And it's really been phenomenal to come over here and just so many people in such a big geographical area.
Great. One more quick question.
Yeah.
Can you share any insights from your experience with COVID? Since in our class we've discussed COVID from the point of view from many different countries, but I've really never discussed what happened in New Zealand. Can you give us a 2-minute overview?
I can, yeah. So New Zealand took a very internationally recognized approach to the COVID outbreak. Jacinda Ardern was our Prime Minister at the time, and the government took an approach of a complete lockdown and ensuring that citizens were safe and at home, and pretty much everyone stopped working apart from primary care providers. So my parents were both deemed primary health care providers, and so they continued to work, but for the most part everyone was at home, locked down. I remember studying for maybe my sophomore year of high school, and it was really a crazy time. I know that we had a really high vaccination rate, and we got like a vaccination card on our phone where we couldn't go into some stores if we didn't show proof of being vaccinated, which I remember talking to you about and seeing how crazy that was compared to here in Florida.
So before you could walk into the store, you'd have to show your...
So you'd have a vaccine phone. ID. I remember one time I wanted to go to the movie theater and they asked me to show my vaccine ID before I could go and see the movie, which is just crazy.
Was that for each of, did you have to get vaccinated multiple times?
Yeah, so I can't remember how they would update that, but I got 2 vaccinations and a booster as well.
Mm-hmm.
I actually got COVID back in 2021, but really it didn't impact me, and I'm sure that the vaccine being exposed to the vaccine beforehand certainly helped with my recovery rate.
And how long was the country shut down? For how many, was it for a full year or a few months? Yeah,
so I think it's there was definitely like complete shutdowns, and then there were also there were periods when we would go back, and then when there was another outbreak we would go back into lockdown, and so it was a bit more on and off throughout 2020 to 2022, but because we had such a high vaccination rate, we really had that herd immunity, and that allowed us to get out of lockdown maybe more quickly and ultimately allow us to get back on track economically and continue with my own personal education back in high school.
And what was the reaction to the people from the people in New Zealand to the lockdown? Were they supportive of it? Was it mixed? Or?
I really think it's mixed, and I specifically remember there being protests in my own town about vaccinations and needing to get vaccinated and needing proof of vaccination. I remember that being a hot topic. Generally though, and I think that's shown through like the international recognition, I think everyone in the country was quite happy with how things went. I probably have a personal bias, but as I said, both my parents are doctors, and I'm lucky to have had a good education, so I can understand the real benefits of being vaccinated and going into lockdown as quickly as we did. Although there are certainly differences in the level of education in different parts of the country, and that certainly showed up in how different people responded to the government's decision, because it was really quite a national decision. Unlike in the States where each state could sort of respond differently, we took a national approach, and what the government decided to do was really what happened for the entirety of the country.
Great. Awesome. Well, thank you so much, Ollie, for spending some time with us. It was great learning about New Zealand. We're so happy you could join us.
Thank you very much.
And if anyone has questions for Ollie, any further questions about New Zealand, about COVID, about anything in the country, you can email me or text me, and I will reach out to Ollie and get your questions answered. But
fantastic.
Thank you so much. It was great having you here, and thanks so much.
I'm going to go and enjoy the pool now.
Yeah, great. Thanks.